Last week, as Delhi NCR air quality dipped to very poor and severe levels, on Urban Reality, we brought to the table the key issues leading to air pollution in the region and the government's inability to make any significant impact on air quality. This week, guess what? Air pollution is back because the World Health Organization, or WHO, has finally put it in black and white, what we've always been very afraid of. The harm this toxic air causes to young children. The WHO report says every single day, around 93% of the world's children under the age of 15 years breathe air that is so polluted, it puts their health and development at serious risk. Many even die. The figure of such tragic deaths amongst children was 6 lakhs in 2016. Now let's place this in the context of India, where 14 out of the world's 20 most polluted cities are. According to WHO report, India tops in death of children below 5 years. In our country, we have lost at least 1 lakh children below 5 years to air pollution. Now that's the big irony of what's really happening here. Let me introduce you to my panelists, who are, of course, here to talk about what the health implications of air pollution can be. We've got leading health specialists, doctors, and of course, research scientists, Dr. Dhiren Gupta, Senior Pediatrician, Sir Gangaram Hospital. We also have with us Dr. Anant Mohan, Head of the Department of Pulmonology and Sleep Medicine at AIIMS. We have Sunil Daya, he's an air pollution campaigner with Greenpeace India. And we have Pulash Mukherjee, Senior Research Associate, Center for Science and Environment. I should be going to the doctors before, but I am going to go to Pulash because, Pulash, I remember last year, same time, doing this discussion, and you said, Manisha, you can play the same show next year, I can promise you. That's how bad things are.
Yeah, I mean, we've been seeing this from 2016 onwards, around the time of November. That's when it peaks. That's when everyone talks about it because it becomes visible then. You have the smog in the air, and not to mention that this toxic air quality is affecting our health and our children's health through the year. So it's not just this period we have to be worried about. We
only wake up in this period because we can see it. Before that, we can't see it. So let me come to Dr. Mohan. Dr. Mohan, tell me, is there physical evidence, more patients coming into AIIMS, more children coming into AIIMS over the years?
Yeah, definitely. I think in this particular season, there has been a visible change in the number of OPD visits, definitely, and maybe I would say a rough estimate 10 to 20% more, roughly I would say. That includes adults as well as children. So no doubt, and most of them are those who already have some pre-existing lung disease. They come with uncontrolled disease, worsening symptoms. They need more medications. Then there is a segment who previously were healthy and now they are coming with new onset of respiratory symptoms. There are some who come with persistent respiratory symptoms. So there is no doubt that the number is increased, and even I would say hospital admissions probably also are behaving the same way, because those same people...
So there is concrete medical evidence that the incidences of respiratory diseases are going up both amongst adults and children.
Yeah, sure.
And you've seen that trend happening. Dr. Dhiren Gupta, let's come to children per se, because this report actually focuses on children. Gangaram was one of the first hospitals in Delhi to have a pediatric ICU, which you were setting up. I remember 15 years ago when my child was very sick and going there. ICUs today in this city, even if the numbers have multiplied, are always full. They say that it's extremely hard to get your child into an ICU in the national capital region. So that's how many children are falling ill in an affluent city like Delhi.
See, I tell you the trend of past 20 years. I am here for past 20 years in intensive care, and I am doing pulmonology also. Past 20 years, certainly past 5-6 years, I'll say the diseases has changed. It's mainly respiratory diseases, and when we talk about kids, not only patients with pre-existing lung diseases, they are on the rise and they are getting severe problems and getting admitted. I'm talking about many viral infections like RSV infection. Past 3 months, it is on rise, and they are presenting off-season. This is not a particular season where we get diseases like bronchiolitis, and now we are seeing the uprise of the bronchiolitis.
Is there a connection with air pollution?
Yeah.
Do you believe that?
People have studied that these type of viral infections and pneumonias are more prevalent whenever there is PM 2.5 is on rise. And what people tried, they have extensively studied that if you pollute the airway, the bacteria sticks better than a non-polluted airway.
I mean, I know the word better shouldn't be used, but it actually sticks to your lungs
sticks. It's
more.
4 times sticks. It's better sticks 4 times. So what WHO has done, it has just shown the mirror.
It has shown the mirror.
It means past 20, they have just compiled the 20-year studies, past 20 years, and they have compiled it systematically, and they analyze it, and they found it is leading to not only morbidity. Till now, we used to relate it to the pollution leading to more cold, more cough, more eye irritation, and now they have related with not only in a patient with pre-existing lung disease, in a normal population also, it leads to it lowers the respiratory functions. In utero, it affected. I mean to say, lot of things, new things, they
are emerging. Tell me one thing. They say, I mean, and these are researches which have proven that pregnant women, when exposed to polluted air, are more likely to give birth prematurely, have small, low birth weight children. It also impacts the neurodevelopment and cognitive ability amongst children. Do you believe that?
Yeah. Why I'm saying so, past 6 years, previously we never encountered people with lot of autism and ADHD. I mean, these are the diseases which are linked with the neurocognitive.
Every family almost now has one child which might have ADHD.
So these type of problems are emerging, means the practice has changed. And in good affluent families, you get these type of diseases. It is really shocking. And you find almost 90% of the families have nebulizers. Previously, I remember in 1993 when I started my pediatric practice, there hardly any nebulizer in the whole of the department.
Right.
So practice has really changed over the time.
Now doctors, I believe, actually between 0 and 2 years, tell parents at their first appointment that please keep a nebulizer if you're in a city like Delhi or any of the polluted cities, Dr. Anand Mohan?
Yeah, exactly, because I think respiratory diseases are so much on the rise. There's so much on the rise and one doesn't know, and then at that point of time, one wants to be ready. So one has to keep all these things. There is the asthmas and all these bronchiolitis and viral infections particularly, they're all on the rise actually.
Just pointing to that, there is evidence of this from Indian sources. We don't need to look to the WHO. Last year there was a report that said that the leading causes of under 5 mortalities earlier used to be dysentery and diarrhea.
Okay.
Now that is shifting away from that towards respiratory illnesses and COPD.
So there is a big shift.
So that is now a bigger killer of under 5 children than dysentery and diarrhea, which used to be the leading cause.
The spectrum of disease appears to be changing.
The spectrum of disease is changing because of air pollution. I mean, this is shocking. But Sunil Daya, this is something that Greenpeace has been saying. I mean, despite all the arguments to the contrary which come from policy makers, it is a reality which is staring at our face.
No, this is definitely a reality, and all these discussions which we are doing have been happening in the research papers, in the reports as well since decades, and the government was till last year was not even ready to acknowledge air pollution as a health crisis.
Are they acknowledging it now?
At least coming up with a national clean air program, which is not at all in the best form it should be, is an acknowledgement saying that yes, India is polluted. But when it comes to these WHO kind of studies or even Greenpeace study, the argument we hear is these are international studies and we don't have Indian evidences. Doctors saying it here gives the evidences very clearly.
CSE is very much Indian.
That's the issue. And along with what we have been discussing, the new disease and all those things, look at the cancer cases, lung cancer cases. They have multiplied many folds in last so many years. And to develop cancer, doctors will correct me, you need 25 years of exposure to carcinogens, and now people in early 30s or late 20s have started developing.
Is there a direct correlation, Dr. Mohan, between lung cancer and air pollution? Because, you know, I read somewhere that now 60% of lung cancer patients in Delhi hospitals are actually non-smokers. Do we take that as an evidence that it is air pollution?
Yeah, so that is well published from our country itself and even our institute, that there is a significant, the proportion of non-smokers causing lung cancer also appears to be increasing. So what could be the reason for that? The reason has to be something else. Most commonly it is the environmental factors. And that includes, most common, the most dangerous would be the air pollution and the carcinogenic effects of the air that they are having. So there is no doubt, and even the age factor that he said, that is also true. That we are seeing more and more lung cancer in a more and more young age. Even 20s and 30s we are seeing, which is really unbelievable.
I would like to add one point.
Sure.
Means if you go through the recent report, it's around 167 pages. I could go through almost all the whole of the report, and what they have found that lung cancer is directly noxious stimulus because of the, that is, you know, it goes with the common sense that you are directly adding to the noxious stimulus in the lung. But what they have found, if mothers are exposed and if kids are exposed in infancy, then they have found that there are more chances of leukemia development in pediatric age group, more retinoblastoma, more congenital heart disease.
So it's not just lung, it's congenital heart diseases. You could even have blood cancer like leukemia.
Yes, yes.
Seriously?
Yeah, you just go through the report and it's really shocking, and you know, presently we have got a patient of leukemia who has come from the north, that is Kashmir, and she is almost non-salvageable. Means that is shocking. Age 15-year-old and suffering from lung cancer, from your leukemia. So that everything goes on rise, and probably we need to systematically analyze in India. We always say that there are no systematic studies in India, so we close our eyes. That as because we don't know, probably things doesn't exist. And if you look at the data, as we are actually living in a smoky area, everybody is smoking, whether they are actual smoker or not, isn't it?
About 25 to 30 cigarettes a day in Delhi. That's the statistics or numbers which have been cited. All right, let's come to the kind of response that are you seeing? Yes, there's a national clean air program. There is GAP in Delhi. GAP is only when situation becomes poor to very poor, an emergency. Today we saw sprinkling of water. But Palash, we had expressway inaugurated in a big way, saying that 50,000 trucks are not going to enter Delhi and the air will be cleaner. They will be fined heavily if they enter Delhi. I'm telling you, at late night, when I was returning from Gurgaon, there was a complete jam on the Gurgaon-Delhi highway, all trucks coming into Delhi. What happened to that? I mean, even things like that, is there a policy gap? Is there an implementation issue, or is there simply not a recognition that this is a serious emergency?
I think a little of all of what you said. The first thing I want to say is that things are being done now, but the things that are being done now, the solutions, those are not something that there is no silver bullet solution to air pollution.
Okay.
So everything will take time, and it is being done at a regional level. At a state level rather, whereas it needs to be done on a regional level. So what is happening is that Delhi has its own rules, which are not replicated in Noida, in Haryana or a UP or a Rajasthan or a Punjab, and that is what is causing the mismatch. Even within Delhi, there is politics being played over what should be done, what should not be done.
Right.
For instance, the GRAP that you mentioned, that was meant to be a reactive plan.
Okay.
It was meant to be supplemented by something called the Comprehensive Action Plan. This is also has been, both this and the NCAP has been brought into effect by the insistence of the Supreme Court. This is not something that the government came up with.
It's literally that the court is coming and saying, do it, do it, do it. And then you have a new PIL coming in from, you know, the extra vigilant Hindus who say, why are you banning all crackers? So, you know, you now bring back crackers, saying that we don't know whether there's availability of green crackers. So even on the policy front, Sunil Daya, there seems to be a huge amount of flip-flop. My question is that when these people go and file a counter PIL or a counter argument in court, they're all living and breathing the same air. Do you think there is a lack of just probably dissemination of information on what air pollution can do? I mean, you and I are talking about it, but does an Aam Aadmi on the street know what it's doing to his lungs?
I'll say that at least people in Delhi have started realizing, and there is more and more awareness. But if we go away from Delhi NCR, the debate has not reached the masses and people really don't know much. And the second issue with the policy is that look into Delhi.
I can interrupt you. I mean to say, in Delhi, I live in Delhi. People feel that my house should be safe,
and that's
not the community.
And this is not at
we fail at individual and community level. We always look forward for the political who are interested in statue and lot of things, and they are this pollution doesn't have a political limit.
Yeah.
There is no boundary. So we are at a political level. We are fighting with the MCD and the Delhi government. We are fighting with the Punjab government, Haryana government. There is nothing constructively done from the center except some new statues from where you can see it's all polluted.
That brings us to all the actions. Look at GRAP, look at PM Task Force, look at Niti Aayog document, Breathe India, look at NCAP now. All these documents have come, nothing has changed, and the only thing which is stopping air pollution to be reduced is the political will, because till now, how many of us have heard any city, state or the central government saying that we'll reduce pollution levels by 35% in next 3 years?
Well, at least finally Prime Minister had a conversation on Mann Ki Baat on air pollution, if nothing more, even though it was a very limited one. You know, more than 40% of world's population, which includes 1 billion children under 15, are exposed to high levels of air pollution. A lot of it is happening in low-income and developing countries are susceptible, as we see, and of course, India definitely falls in that bracket. When we come back, if political will is missing, then what do you need? Do you need a mass movement? Do you need people to rise up and say, look, we have to put a stop to it? Let's come back and talk about that.